السلام عليكم ورحمة الله وبركاته. معكم عبد العزيز التيبي. Today me and my colleague will talk about pneumonia. As a start, we will ask ourselves four main questions, which is what is pneumonia, how does pneumonia happen, who can get pneumonia, and why is pneumonia serious. What is pneumonia? Pneumonia is a lung infection where tiny air sacs alveoli become inflamed and filled with fluid or pus. This prevents the lungs from doing their main job, exchanging oxygen and carbon dioxide. How does pneumonia happen? Most cases begin when a person inhales germs that reach the lungs. The body tries to fight the germ, causing inflammation, swelling, fluid buildup. This makes breathing harder and reduce oxygen levels. Who can get pneumonia? Anyone. But the risk higher for these types: young children, older adults, people with weak immune system, people with chronic disease like asthma and COPD. Why is pneumonia serious? If not treated, it can cause trouble breathing, low oxygen levels, lung complication. That's why it's need early recognition and treatment as important. Pneumonia is common, but needs fast medical attention to prevent it. Because it's like it's an inflammation. The longer it gets, the badder it's happen. And I will leave you with my colleagues.
And here we have the causes of pneumonia. Pneumonia can occur when infectious organisms enter the lungs, including bacteria, viruses, fungi, protozoa, and parasites. The types of pneumonia may also vary based on where it is acquired. For example, community-acquired pneumonia, which is referred to pneumonia acquired from normal social contact, while the hospital-acquired pneumonia, which is also called nosocomial pneumonia, is an infection whose development is caused by the hospital environment. And the ventilator-acquired pneumonia is defined as pneumonia that develops more than 48 to 72 hours after endotracheal intubation. The presentation and severity can be different with each pathogens and each settings. While the non-infectious causes, pneumonia may also develop without a direct infectious organism. Aspiration of gastric contents or oropharyngeal secretion can lead to significant lung inflammation, and exposure to irritating chemicals such as chlorine may cause inflammatory pneumonitis. These non-infectious cases can sometimes mimic the CAB or HAB or VAB in their clinical presentation, but the underlying mechanism is not microbial. And there is several factors increase the risk of developing pneumonia, like older adults, especially those over 65 years, are at significantly higher risk due to decreased immune function. The aspiration of oropharyngeal secretion is another major contributor, particularly in the patient with swallowing difficulties. Pneumonia can also occur following viral respiratory infections, which weaken the lungs and make bacterial infection more likely. And the individuals with chronic illness or chronic respiratory disease like COPD or asthma or cystic fibrosis, and the patient with cancer, especially lung cancer, and prolonged bed rest, and the patient with tracheostomy or endotracheal tube, or abdominal or thoracic surgery.
Assalamu alaikum. My name is Faisal Amar. Today I will talk about symptoms of pneumonia. Symptoms vary greatly depending on the patient-specific underlying condition and the type of the organism causing the pneumonia. General symptoms: fever, shortness of breath, chest pain, fatigue and weakness, tachypnea, tachycardia, crackles. Viral pneumonia symptoms: dry cough, fatigue, headache, muscles aches, wheezing may be present. Bacterial pneumonia symptoms: high fever, protective cough, sudden onset, sometimes hemoptysis, more severe symptoms. Thank you for listening.
Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Muhammad al-Nimri and I will talk about the diagnostic part of pneumonia. First of all, we can divide the diagnostic of pneumonia into three main components: the clinical evaluation, the imaging, and laboratory tests. We will go through them starting with the clinical evaluation. In the clinical evaluation, we mainly look in history of the patient and present of physical signs and symptoms. We will look if the patient have a productive cough, fever, dyspnea, chest pain, and risk factors like age of more than 65 as our reference says. In the physical examination, the auscultation may have crackles and or bronchial breath sounds. Egophony may be present, where the patient's E sound is heard as an A over areas of consolidation. Also a sound of dullness on percussion. The second diagnostic tool we have is imaging diagnosis. We use the X-ray as the first line imaging tool. A lobar consolidation sign is common in bacterial pneumonia. As you can see in the first picture, it shows a right upper lobe consolidation. Another sign is the patchy or interstitial infiltrates, and it's a common in viral pneumonia. A cavitation may appear in necrotizing pneumonia, as the second image shows. The last tool is the laboratory tests. We use the complete blood count test to determine if it's a bacterial or viral pneumonia. If it's a bacterial, we can know the type of the bacteria by using the sputum gram stain and culture. All these tools can help to diagnose pneumonia. That's everything for me, and I will leave you with my colleague Muhannad.
Assalamu alaikum warahmatullah. I'm Muhannad. I will talk about treatment of pneumonia. Pneumonia treatment depends on the cause and the severity of infection. We used antibiotic for bacterial pneumonia and usually shown improvement with a few days. If the pneumonia because virus, we use antiviral medication. And antifungal medication are given for rare cases of fungal pneumonia. Also, there are supportive care. Supportive care helps reduce symptoms and speed up recovery. Includes fever reducers and pain relievers, for example, acetaminophen. Adequate hydration to prevent dehydration and rest to help the body recover, and oxygen therapy for patients with low oxygen levels. And hospitalization may be required in severe cases.
Hello. Hello, my name is Abdurrahman and I will talk about prevention of pneumonia. Pneumonia is a serious infection that affects the lungs, but the good news is that many cases be prevented by taking protective steps. Prevention focus on reducing exposure infection agent and strengthening the body defense. Three ways to avoid getting pneumonia. The first one is vaccine. Pneumococcal vaccine protect against common bacterial causes of pneumonia. Influenza vaccine reducing risk of flu-related pneumonia, and COVID-19 vaccine helps to prevent viral pneumonia caused by coronavirus. The second one is a healthy lifestyle, maintaining a strong immune system through balanced diet, regular exercise, and adequate sleep. Avoid smoking and limit alcohol consumption, as these weaken lung defense. The third prevention, hygiene practice. Wash hands regularly to prevent spread of germs. Use mask in crowded place during outbreak. In conclusion, pneumonia is serious lung infection caused by bacteria, virus, and fungi. It begins with inflammation in lungs, making breathing difficult and reducing oxygen supply. Common symptoms include cough, fever, chest pain, and shortness of breath. Diagnosis usually involves physical examination, chest X-ray, and lab tests to identify the cause. Treatment depends on the type of pneumonia and may include antibiotics, antiviral, antifungals, and supportive care like oxygen therapy and hydration. Prevention is the best approach. Vaccines such as pneumococcal and influenza vaccine greatly reduce risk, especially for children, older adults, and those with a chronic illness. Good hygiene, healthy lifestyle habits, and avoiding smoking also play a major role in prevention. In summary, pneumonia can be dangerous, but with awareness, early treatment, and preventive measures, its impact can be significantly reduced. And thank you.